A very good afternoon, dear students. I'm Dr. Sangeeta Nath, Principal, Oriental College of Education, Sanpada. Today I am here to highlight on the topic Module 3, Part 1, Making Learning More Meaningful, Do's and Donuts. Dear students, this juvenile delinquency and the traumatic brain injury is the first and foremost important topic of today's discussion. So let us begin with the concept, what is juvenile delinquency? Juvenile delinquency is also known as the juvenile offendings. That is the act of participating in an unlawful activity or the behavior of a minor of individuals younger than the statutory age group. For example, in the United States of America, a juvenile delinquent is a person who is typically below 18 years of age and commits an act that otherwise would have been charged the crime if it is the same thing if it is doing by an adult. Juvenile delinquency can range from status offense, underage, that is smoking, drinking, to the property crime or the violent crime. Anything that can be done and that is considered as juvenile delinquency if it is under 18 if the child commits the crime. Then what is juvenile delinquency? Juvenile delinquency, that earlier also I told you, it is the offending act of participating in an unlawful behavior as a minor under 18 group or individual younger than the statutory age of maturity, that is above 18 years. There are three types of juvenile delinquency: status offense, property crime, and violent crime. So what are the acts of this delinquency? The act of delinquency includes running away from home without permission of the parents, habitual absenteeism, and beyond the control of parents. Third is use of vulgar language. Fourth, wandering rails, roads, streets, and marketplaces. Visiting gambling centers is also considered as the act of delinquency. Committing sexual offenders, shoplifting, stealing, all these are also included as the act of delinquency. So what are the causes? What are the causes of this juvenile delinquency? There are several causes, but few are the chosen one: bad company, mental conflicts, love of adventure, school dissatisfaction, poor recreation, if it is the street life, or the vocational dissatisfaction. Then we can proceed why these things happen. The classification of causes of delinquency. All the causes can be broadly categorized into two types, that is social factor and personality factor. So the social factor includes the broken home, poverty, delinquency areas, companion and gangs, or begging. Then other social and environmental factors also includes the school dissatisfaction and the film, and nowadays the pornography literature is also the very important factors which affects the juveniles. Then proceed towards the personality factors. Let me clear you here. Personal or individual factors. The mental deficiency in delinquency, then it has been observed that a good number of delinquents are mentally deficient. They are not mentally good. So it has been observed that these mentally deficient children are also facing emotional problems. These mental troubles and emotional maladjustments are a strong factor in delinquents. And delinquents are not born, but they became so due with the social circumstances and personal deficiencies. That means all the social factors, the personal deficiencies, that affects the child to become the juvenile delinquency. So dear students, It may be said that juvenile delinquency is the result of both social as well as the environmental factors, personal and the individual factors. So what about the remedies? If, as of now, we have discussed the causes, what are the acts, then the factors which affect juvenile delinquency, then we should proceed towards the remedies for juvenile delinquency. There are two methods have been suggested. Then the first method is the preventive method. The second method is the rehabilitative method. Preventive method. In order to prevent juvenile delinquency, the following measures may be suggested. Number one is creating a team at the government as well as private level for prevention, giving proper training to the members and the staff of all the organizations concerned with the delinquency control. Then establishing child guidance clinics or giving appropriate treatment to the distributed and maladjusted children. Educate the families to realize the importance of giving proper attention to the needs of their younger generation. Family play an important role here to give proper guidance to the students because young generation, young children are misguided. So improving the social environment, the slum area, busy marketplaces, etc. Then we can have some rehabilitative methods, that is legislative measures and the Borstal Schools Act. Then we can proceed to the second part of our module 3, part 1, that is traumatic brain injury. This traumatic brain injury is called TBI. It is a disruption in the normal function of the brain that can be caused by a blow, bump or jolt to the head. The head suddenly and violently hitting an object, or when an object presses the skulls or enter the brain tissue, then it happens, TBI. The symptoms of TBIs are the loss of consciousness from several minutes to hours, persistent headache or headache that worsens, repeated vomiting or nausea, convulsions or seizures, dilation of one or both pupils of the eyes, clear fluids draining from the nose or ears, or inability to awaken the sleep. Then there are many types of injuries: hematoma, contusion, intracerebral, then subarachnoid hemorrhage, then diffuse injuries, diffuse axonal injury, ischemia, and skull fractures. Types of this brain injuries, we can discuss the different testing and the diagnosis part. That is, a computed tomography scan, that is called CT scan, is the gold standard for the radiological assessment of a TBI patient. Then magnetic resonance imaging, that is called MRI, is not commonly used for the acute head injury since it takes longer to perform MRI than a CT. Then outcome of the TBI. One of the most widely used symptoms to classify outcome from the head injury is the Glasgow Outcome Scale, that is called GOS. Then patients with mild head injury, usually defined as GCA score, on the admission of 13 to 15, which tends to well. Then patients with moderate head injury fare less well. Approximately 60% will make a positive recovery and an estimated 25% left with a moderate degree of disability. Death or a persistent vegetative state will be the outcome in about 7 to 10% of cases. The remainder of patients will have a severe degree of disability. So what we will do? I am giving you one of the example. If there is a case, the Sushant is 20 years old boy. When he was 15 years old, he was made a mistake. Now he realized that he wanted to adjust the normal life. So all the remedies are given below. Can you choose any one? Which is the appropriate one that you can choose? Giving appropriate treatment to the children, educate families to realize the importance of giving proper attention to the need of your children, Then the third option is improving social environment or giving punishment in front of the society. So the best part is, if we are the educators, then we should give punishment in front of the society. That is the best remedy. Another testing question, it's a self-assessment question that I am giving you. When was the past Juvenile Justice Act by the Parliament in India? It's a general question. It is in the month of December 2015. So dear students, today we are highlighted on the most important topic, the how to making learning more meaningful, what are the do's and do-nots, and traumatic brain injury. With this note, thank you. Have a nice day.